Well, Michael, thank you again. I know we've been chatting, getting to know each other a bit more over this time. So for our listeners, I was wondering, because you're kind of a bit of an expert on FND, if you could maybe just, let people know what exactly is FND.
So FND is a highly common neurological, psychological, psychiatric condition that not many people know about, and it's one of the most underdiagnosed conditions that people who are having functional neurological symptoms will present to their GPs and go and see neurologists about. And what happens is patients with FND often fly under the radar because after seeing a neurologist, they're often presented with the fact that there's no structural cause that, to the neurological experiences, conditions, and symptoms that they're experiencing, which leaves people in a very desperate, helpless place because essentially what's happening for them is a disconnection between the brain hardware and the brain software. And what I mean by that, the brain isn't communicating the right signals to the body, and the body isn't returning those signals. And so as a result, people with FND will experience symptoms like what we call functional seizures. So in that context, experiences of convulsions that will last from anywhere between 5 minutes to an hour, that there's no structural explanation for what's going on. Some other people experience what's called functional motor disorder. So, and that can affect gait, it could cause tremors, dystonia. Another FND symptom or condition is called functional cognitive disorder, which essentially causes problems in word finding, in conversation, memory problems, attention problems, cognitive fogging and cognitive fatigue. So it's really an umbrella term to describe lots of different conditions. In fact, I guess it goes broader than the conditions that I'm talking about. For example, conditions like migraine or chronic fatigue or irritable bowel, they're actually functional conditions, but there's no underlying structural cause.
Mm-hmm, mm-hmm. And I think I know another client that I had, she actually had presentations where she lost her ability to speak and to swallow. That sometimes, it can show up in neurological issues around throat and voice and swallowing.
Right?
Mm-hmm.
Yeah. It's a common condition that's often treated by speech pathologists. And again, like you said, there's no structural cause to it. And so, look, one of the things I should add to FND is that traditionally it's been something that's been diagnosed through the process of exclusion. So lots of tests that can go on for months and delaying treatment that's need to be implemented very quickly once FND's detected. And so now there's a greater shift, or there's a shift to diagnosing the conditions using positive clinical signs. For example, with functional limb weakness, what neurologists or GPs can see is that there's improvement in flexion or hip abduction against resistance, or for example, tremors. Functional tremors can be stopped with distraction. So those kinds of indicators that there is a software issue going, and that can be resolved through a shift in attention. Whereas if it was completely structural, the body wouldn't be able to respond in a way that we would expect.
And share with listeners the importance of that early, a quicker diagnostic sort of process. Why is that really important?
So what we're trying to do is prevent aberrant neuroplasticity. So the longer the condition goes without treatment, prognosis is poorer because I guess illness beliefs take stronger effect. The symptoms themselves become more and more debilitating, and so much and a big part of that is, I guess, through neuroplasticity, that communication error with FND gets worse and worse over time. So if we intervene quickly, there's a better chance of correcting a lot of the symptoms through things like distraction, through energy management, case of occupational therapy, for example, physiotherapy, learning how to walk and recognizing that, or engage in movement control, for example, dystonia or tremor, realizing that distraction can play a major part in preventing the symptoms. I guess, fundamentally, the illness belief that the brain is damaged and the body is damaged, the longer that goes on for, it creates this negative expectation about one's capacity to function in everyday life.
And so FND sometimes has been, other terms have been used. Yeah.
Yeah. So we've been talking about FND now for centuries. And so from Charcot to the present, well, I guess to the start of the 20th century, I'll start again. From Charcot in the 19th century, mid-19th century to really to the 1990s, we were using the term conversion disorder, and that diagnosis is still in the DSM-5. And so the conversion disorder theory posits that the body manifests somatic symptoms as a result of repressed trauma or long histories of childhood abuse or whatnot. And so psychological symptoms manifest as physical symptoms. But what we've discovered in the last 25 years through the work of people like Mark Edwards and John Stone, and is that there is a biological basis to what's happening, that the way that people with FND, their brains work differently to people who are, say, feigning the condition.
And I know through our discussions before that there's definitely a movement in like a stress model or looking at, obviously we've had chats about polyvagal, like a polyvagal lens. That there's definitely movement within the field of understanding FND, of looking at it from a stress model.
Yeah, and a real game changer at the moment, we're about to sort of, I guess everything's about to be flipped again with the work of Lisa Feldman Barrett, her work around the theory of constructed emotions and the role of interoception and prediction error. And so that really ties in nicely with the stress systems model that looks at allostasis. Sorry, I forgot the word. Essentially, energy conservation. What the energy that we need to manage everyday life, and how things like psychological factors or social factors or biological factors can drain the energy that we need. Yeah, and this, yeah, like we talked about, the stress systems that respond to those attacks on the body.
And I think when you're given one of your presentations before, you talked about that they have looked and saw like biological markers to show that there's like a stress sort of immune response happening in the body.
Yeah, and look, what's really interesting, I guess, some of the work that I've been looking at lately is the fact that any shock to the to the body and the brain can trigger functional symptoms. And for a lot of people, it's often benign events such as physical illness or a surgery or an injury of some sort, not necessarily brain injury that can trigger a first functional symptom episode.
Well, Michael, I think this segues beautifully into you telling your journey with FND. Yeah. Just because I think that really highlights that. How you had sinus surgery, and so anyway, I'm going to let you.
Sure.
Share that.
So I'm a clinical psychologist. I've been practicing over 20 years now. One day out of the blue, I woke up and I couldn't walk properly. I was stumbling around like a drunk. And the odd thing about that was, in my mind, it felt like there was nothing wrong, even though my wife could see that there was something very wrong because I was crashing around the house. And it was an amazing experience of feeling so disconnected from my body. Within 48 hours, things got worse, and eventually I saw on the second day, I saw my GP, who said to me, "You have to go to hospital now." And so my wife took me to emergency, and on the way to emergency, my condition got worse, and I began slurring, and I looked like I'd had a stroke. And when I got out of the car, I fell out of the car and had to be wheeled with on a wheelchair. And so 2 weeks in hospital with lots of tests. There was no I wasn't given an explanation, but what was one of the things that got brought up was the possibility that the condition was functional. And I was absolutely furious to believe that there could be any psychological, that this could have any psychological underpinnings, and that it was a stress response. And that was more or less what I was told. And so when I returned home, my symptoms got worse, and I started experiencing what's called psychogenic non-epileptic seizures. So these are seizures that mimic epilepsy. However, they're very different in presentation and duration and brain activity. So these were becoming more frequent. My gait disorder got worse. So I was walking around, supporting my upper body, using my hands on my knees, and experiencing chronic pain as a result of convulsions in my body. And as my symptoms were worse, as my pain got worse, a whole heap of other symptoms came with that. For example, chronic hyperactive bladder and mental fatigue. And so with that came insomnia, because I would go to bed in pain. I would sometimes have seizures in the night, and then when I finally fell asleep, I'd be woken up about 3 times because I was needing to go to the toilet. And so when I saw a urologist, and after a cystoscopy, everything was fine. I was feeling more and more desperate, and that this story sort of really resonates with a lot of people I've spoken to with FND who've had this experience of being told, not really given the information that they need to understand what's happening to them. And because it's so scary, because you become unrecognizable to yourself, and the fear that, is this what my life is like from here on end? So I had to work really quickly, and I had the advantage, being a psychologist, because I could research and understand a lot of the literature about what FND was. And so I essentially educated myself, and through that process I found that different support channels like FND Hope and the FND Society, the FND Support Services Australia, and at the same time, without sort of realizing what I was doing, I created a multidisciplinary team, which is essential to FND treatment. So when I say I created, I just started calling around, and I decided I needed an occupational therapist and a psychologist that specialised in FND. I needed a neurologist that knew what he was talking about, and a physiotherapist that specialised in FND. And gradually I put together a team, including a neuropsych, yoga therapist. Well, I started off with yoga therapy, which made the greatest difference in terms of my gait. And that's been essential in my journey getting better.
So can I ask, Michael, at what point did you actually kind of accept the diagnosis? At what point through all that? Was it just through the research? Because I know that you said that it's one of the most important components of getting, your road to being well is that accepting that diagnosis. So where was that for you?
I can't pinpoint it exactly, but I think, like what you said, doing the research and recognizing, okay, I'm experiencing what these people are experiencing, or what I'm reading about in the research, and that was the moment where I realized that, okay, this is what I've got, and I've got to do something quickly, because I don't want to live like this for the rest of my life. I want to be able to function better as a partner, as a friend, as a father, and as a professional. However, a lot of people get stuck and have really bad experiences as a result of talking to clinicians that aren't FND savvy, like their GPs or neurologists or psychiatrists. And often people with FND get referred on to psychiatrists because they're essentially put in a too hard basket. And this comes back to the conversion disorder theory. There's that belief that this is just a psychological condition, which if a person who's experiencing FND sees someone who isn't FND savvy, it's incredibly invalidating for them to hear that it's all just stress, or if it's all in their head. And over time, people become more and more desperate, and then seen as malingering or personality disordered nuisances, essentially. And it's sad because people with non-epileptic seizures present very frequently to accident emergency in hospitals, and so these people get stuck in a vicious cycle of trying a long search, trying to find an alternative diagnosis. And again, that prolongs, the period of time between treatment, identification and treatment. And so acceptance is really crucial. And for me, fortunately, I got over that sort of that disbelief of what I was experiencing, which, has helped me tremendously in getting better.
And then your team, you said the team was really, really important in terms of.
Yeah, and I'd say in my team, I guess the person that was really the team leader, not that all the clinicians were talking to each other, because they're all over across the country. The person that I came to the most, apart from my yoga therapist, who I'd see 3 times a week individually, was my occupational therapist. And I learned probably the most in terms of managing my symptoms through her. And it was later on through my psychologist that I'd learned about the stress systems model and its relationship to my symptoms, all my risk factors that were driving the condition. But yeah.
So what kind of work were you doing with your occupational therapist that was the most helpful? What kind of things?
Yeah. So the first thing that we worked on was one, learning all my warning signs. Essentially what we started doing from the beginning was developing a relapse prevention plan, which involved learning what my warning signs were, tracking them, learning about the boom bust cycle, learning to pace myself, and essentially structuring my day around that. So we put together a daily routine for the week, in which we would sort of look at high, moderate, low demand activities and where to place them in order to prevent seizures, which would always, I'd be at greater risk of seizures in the evening because due to fatigue, physical fatigue and mental fatigue.
So that's where that sort of energy model comes in, doesn't it? Yeah, looking at the fatigue levels and how the brain's coping with that. Yeah. And then I believe that there's an app that you found really helpful.
Yeah, so there's a number of apps available now. When I started this journey, there was really nothing. That was FND specific. So the app that I used to keep track of my symptoms is called #TrackIt, and I use that with my watch, and so I'd get reminders every hour to basically rate what my different symptoms were that I punched into the app. And so the idea of that was not to draw attention to my symptoms in a way that it was going to cause me distress. It was more of okay, check in now. How much stress am I experiencing? What's my fatigue level? What's my mood like, for example? And so I'd rate that, and essentially what it would mean that is if I scored a 5 for any of these, then I needed to stop and if I was at a 5, then I was in trouble. So if I was at a 3, or a 4, I need to stop what I was doing and either use a distraction activity or take rest. In the early days of my FND, sometimes I'd have to nap 3 times a day. But the great thing is now there's some really fantastic apps. There's the Neurosymptoms FND guide, which is essentially the website in an app form. Neurosymptoms is like the Bible of FND for both clinicians and patients. There's the FND Australia Services app, Support Services Australia, and that is a fantastic app because not only does it provide FND education, but it also provides patients with lived experience stories to help people relate and find hope. And it also offers like a symptom tracking component. And there's another app called My FND, which does it's more of a cognitive behaviour therapy approach to tracking symptoms and responding to them.
So they sound like good resources. So I just want to add, because some people listening might be thinking this is more of an adult sort of condition and presentation, but we certainly see FND in children and adolescents as well.
Yeah.
Do you want to speak to that, and then I'll add a little bit about some of my connections in there?
Yeah, I think you'd be able to do a better job of it. From my study, there's a dedicated clinic in Sydney that provides family therapy and treatment for young people, and it's a condition that's becoming increasingly common with children. There's the Bible of the stress systems model, which I know you'll talk about, the Kazier's work, functional somatic symptoms in children. I should add that what we're starting to see now is increased rates of mortality with people experience the functional seizures, and the greatest risk group is actually people under 30, including teenagers. And when I say mortality, I'm talking about suicide risk. So that's really concerning. And I guess the other part of this is that with children, I guess kind of like any condition, for example, like schizophrenia, that the earlier the first presentation of symptoms, the worse the prognosis is if it's not treated, immediately.
Yeah. No, thanks for sharing that. You're right. Dr. Kozlowska's work is really sort of groundbreaking in terms of FND for children and adolescents, and I know from speaking with her, she said yes, the incidence of presentation of these sort of functional neurological disorders in children, with children presenting with psychogenic seizures, presenting with neurological, motor neurological presentations, tics, looking like they've had a head injury, or totally disassociating. And with no, as you say, absolutely no actual biological or physical reason for, and definitely related to stress. And it's not necessarily that there is a big major stressful event as you mentioned as well, but the same for children. It's not like they come from very challenged families where there's a lot of trauma and stress, but there's just the accumulation of daily stress from everything that's happened. Kids picking up from obviously the stress around talk about climate change, to stress of coping in school. They've been going through the pandemic. All these things, and can play out and present in, and as you say, it's like the brain's communication and trying to cope under sort of the stress and the energy absorption from that environmental and physical stress. So so definitely this is a condition that's present in kids and adolescents as well.
I'll add to that in terms of my journey. I was diagnosed with chronic asthma at the age of 2, and I spent a good part of my childhood in and out of hospital, pumped up with a lot of drugs. And I think coming back, looking at the stress systems model, I had developed such a strong biological vulnerability from all the medications that was getting put into my system, and all the trauma and stress of being hospitalized 4 times a year for weeks on end, and that, those kind of aversive childhood experiences really can play a major role for children developing FND, but for adults, if you add that to whole heap of psychological factors and social factors like relationship stress or work stress, or these kind of things can play out in functional symptoms like headaches and body pains and gastrointestinal issues that a lot of children experience and report. And I know in the book, Kazi talks a lot about that as early warning signs for FND in children.
Mm-hmm. 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 So what I'd like to sort of talk a little bit more, move on to now, is I know you've done some different, in your journey, some different things that have been very helpful for you. So maybe I just we'll talk about maybe virtual reality, and then I just love to share with the listeners that that you've now been going through and experiencing the Safe and Sound protocol, and you just sort of share a little bit about, because you've done a lot of work, and now adding something like this tool. What are some of the things that you've noticed? But let's start with the virtual reality, because I think that's a really wonderful tool to share with people who might be experiencing it.
Yeah.
Mm-hmm.
And the exciting thing is with that is it's something that's there's some studies that have come out of this groundbreaking work that are in progress. So with virtual reality, it was introduced to me by my neuropsychologist, and essentially what it came out of is the work of Matt Richardson and his nocebo therapy, nocebo cognitive behavior therapy, and that looks at the role of negative expectations in the pathogenesis and the maintenance of functional symptoms. So our expectation that the body is broken or the brain's broken is reinforced by symptoms, and over time there's that expectation that one can't control their body, that the body is something to be afraid of, particularly when it comes to seizures. So Lynn, my neuropsychologist, started me with virtual reality by playing a game called Beat Saber. And Beat Saber, whilst I was playing Beat Saber, she videoed me doing it. And so Beat Saber is a highly stimulating game which involves holding 2 lightsabers, and you're standing in this virtual world, that's futuristic world, which is really beautiful, and you've got these minimalistic and you've got these cubes coming at you, and one is red, one is blue, and you have a red-blue lightsaber, and you have to hit the cubes with the corresponding color with the corresponding lightsaber. But the trick is each of the cubes have different arrows pointing the way, the direction in which the cube has to be cut. And then on top of that, you are having to do this in time with music, and on top of that, you're having to dodge obstacles coming in your way. And so how this is explained is, doing this for a couple of songs, Lynn later showed me that I'd started, my body movements became more and more fluid, and no different to someone who didn't have functional neurological disorder, functional movement, functional movement disorder in this case. So it was fascinating to watch, and so I went out and bought myself an Oculus virtual reality kit and started playing these games, and it really helped correct what was happening with my gait. But more than that, playing games like Res Infinite, or The Climb, which is a virtual rock climbing game, it would help me manage other symptoms like pain, or fatigue even. And the experience is that when you shift your attention away from your conscious attention to symptoms, particularly when you are in a state of heightened emotions, the virtual reality world sort of helps you restore your restore unconscious normal movement, because you've got no choice. You have to react naturally and then unconsciously in the virtual world. And so you suspend your negative expectations about what your body can do, and you just respond fluidly.
Fascinating. So fascinating. Yes, I know you've had really good results with that. Excellent. So now let's just talk a bit about your experience with the Safe and Sound protocol. And I want to share that you are also a musician. So you have, so you play the guitar.
Yep.
Yes.
Yeah, that's my primary instrument. And the interesting thing through all this is my guitar, if anything, my guitar playing has improved. and probably it was something that was really important in my recovery, because when I was playing my guitar, I didn't have symptoms, and I wasn't paying attention to symptoms. And tying in with the Safe and Sound protocol work is that people with FND have what's called attention bias. So, people, for example, it's really common, say, for people with anxiety, when you're experiencing fear, you really, those emotions, those triggers become really sticky, and it's hard to sort of break out of that. The sympathetic nervous system activation. So similar with FND, just paying attention to symptoms really exacerbates the condition, and so that's where distraction comes in as a really powerful treatment tool. And so with Safe and Sound, the process is very, very distracting, and I say that in a good way, because listening to the music, at first I was approaching it from a musician's perspective, because I purposely didn't do any polyvagal theory research or anything into the Safe and Sound protocol. I wanted to go in with a beginner mind. And so at first I was like, okay, I'm listening to music. What is it that's happening here? And trying to question, okay, there's some bilateral stimulation going on, because I can, there's some binaural sort of panning between left to right ears with certain instruments featuring or crossing over from left to right. And I was thinking, oh, maybe that's what it is. And then I'm thinking, oh, is it certain frequencies? And like I've discussed with you, being such a music snob, normally I would like, oh God, I hate this music. And not because of the way it was performed. I think the way it was performed is fantastic, but just like if I was in a shopping center, I'd have to put headphones on to drown out the music. However, what was what was a massive surprise to me was, at first I found it, I found it very relaxing, and I couldn't put my finger as to why that was the case, because normally, like I said, it would trigger a disgust response. Um, and the first few times I did it, I fell asleep. And I was thinking, I'm doing it wrong. If I'm falling asleep, then it's not working, and I have to do it again. And
Yeah, but then we checked in and we sort of said,
yeah,
no, we don't need to repeat. Falling asleep's good. So
yeah,
just keep
yeah.
going. Yeah.
So the biggest, so before I jump into the biggest win with it was, I started using it, and just throughout the day, and I found that I was becoming more and more relaxed in situations that would normally trigger, for example, having a teenage daughter, having tantrums, um, and that kind of everyday experience that a lot of parents go through with teens. It would, living with FND, I became more and more reactive to any sort of interpersonal stress, or people raising their voice. It would very much trigger. It would send my body stress systems into overdrive, and so I'd either, and quite often I would start to develop functional symptoms. And it was often the gait would be the first thing that would go. And sometimes, if, for example, if I was having an argument with my daughter, or my daughter was having an argument with my wife, but in the early stages of my FND, that would be really triggering, just the sound of people yelling. Nothing over the top, just everyday life, living with a teenager. And so quite often I would slink into a gait disturbance, and sometimes in the early days, I'd actually have falls, or sometimes I'd have to be carried to my bed, because I'd start having seizures. And so with the safe and sound work, I started to notice that my reactivity to what was going on around me was dropping. I didn't get as anxious or angry in response to anything that annoyed me, or upset me. I felt like I was becoming more equanimous in responding to everyday life. And even the things that were stressing me out about money or career and things like that, I just started to feel lighter. But the biggest game changer that happened for me, which we've talked about, was when I felt I started to experience my seizure symptoms come on pretty hard. This was following just some stress at home, and the belief that I had was, that was prior to this, was that, okay, I've just got to deal with this situation. And this was an unconscious belief, mind you. I'm going to deal with this situation. Once that's dealt with, I can go lie down, rest, and have a seizure. Now, that's not what someone with FND is like telling themselves what's going to happen. But through my work with my neuropsychologist and the nocebo therapy, I realized, okay, so there was this negative expectation. This is what's going to happen. And so she talked a lot about, and we looked at exposure therapy in terms of stressful situations that trigger FND symptoms. How do we sort of break the connection between beliefs that I'm going to have symptoms and having symptoms? So on one particular occasion, I noticed, I got through the situation and I noticed the symptoms coming on. And so normally I would lie down and start convulsing. But this time I had the idea following our work together to grab my phone, plug my headphones in, and just listen to the music that I hated, but without hating it. It was just I lay down in my bed, listen to the music, and the symptoms just passed really quickly, and nothing happened. So after 10, 15 minutes of doing that, I was fine. Now, previous to that, I was doing that with virtual reality, and as I explained to you before that, it takes a bit of setting up. Like it's hard to do when the symptoms are coming on hard. Like virtual reality is more of a preventive treatment and something that you can do when the warning signs are starting to flare up. But it requires having to set up a room, putting the headphones and the goggles on and all that kind of stuff. Whereas doing the safe and sound protocol was just really quick and easy. It was just a simple matter of grabbing my phone, opening up the app and plugging the headphones in and just using that to get through. Well, using that as a distraction and two as a therapy.
Mm-hmm. Mm-hmm. Yeah, and that's pretty exciting to hear. And then another thing that you shared with me, that you just sort of noticed that there was a shift in your mood as well. Yeah. You just felt more more positive. And I think you talked about the particular time when I think it was a weekend, and I think the daughter was feeling a bit sort of darker that day, and her mood didn't sort of seem to sort of get under your skin. So maybe if you remember that.
Yeah, so she was she was doing her exams, and so she was particularly stressed out that weekend. And as I mentioned, normally, and a lot of people I hear this a lot with people with FND. Some people talk about feeling like a complete, being horrible to their family and friends because they're so reactive to anything that stresses them. And so for me, is how I dealt with other people's stress around this time was to feel helpless and feel more fearful or angry if I couldn't sort of solve the problem. And so and on top of that, the functional cognitive aspects make it very hard to communicate when you're feeling stressed. So on this particular weekend, I was using the protocol, and it felt like my old self again, that I could just respond to my daughter and be there for her without getting caught up with what she was experiencing.
Mm-hmm. Mm-hmm.
Being the dad that I wanted to be.
I bet that felt really good.
Yes. Yeah, it felt like I was the old Michael was coming back.
Mm-hmm. Mm-hmm. Excellent. So we're almost done with the protocol. So is there anything else that you feel like you've noticed that might
have? So yeah, I had a break after a week from feeling sick, and I'm not sure if it was an FND thing or just a viral infection. I think it was probably more that. And coming back to it, the other day I was feeling stressed out, and my wife was saying to me, look, and sorry, no, I was feeling stressed out, but I was also exhausted. And normally, back in the old days, I would need to go and have a 10 to 20-minute sleep. And she said to me, well, why don't you do, something different? And so instead of going down to have a sleep, I just grabbed the headphones and did an SSP session. And normally with fatigue and FND, it often results in pain symptoms. So after 12 to 15 minutes doing the SSP, I just felt rejuvenated, and I felt like I'd had a sleep, and I came out of it without any pain symptoms and or fatigue. So that was another wonderful experience to report.
That is.
Mm.
That's excellent, Michael.
Yeah. And look, I should sort of, I don't want to sort of create any false hopes, because for people with FND, it's such a nebulous, insidious condition, and everyone has a very different experience. And from the conversations I've had with people with FND, some things work better for others, and some people, some things don't work at all. For example, a lot of people had tried virtual reality, and for people who had different experiences, some people have had tremendously helpful experiences with EMDR, and some people didn't find it helpful at all. And I guess it's like that for every person. What's exciting, I think, for me and for the SSP community in this respect is that I live with FND, but I went into this treatment almost, I was blind. There was no expectation. I didn't have any expectation that it'd work, and or vice versa. I didn't want to know any of the mechanisms. I just wanted to experience it. So now I'm going to go back and find out what was actually happening.
And we can talk more about that when we set up. But so we have already talked previously about Dr. Kozlowska and her work. She works at the Westmead Children's Hospital, and they have a FND inpatient program there for children and adolescents. And as you said, FND is so complex and unique to everyone's nervous system and what people respond to at different times. And they have a pretty intense program. And I know they had a particular case of a young adolescent female who had gone through their program, doing all their mindfulness, all their physio, all their sort of FND informed clinicians working with her, but she was not able to really get anything out. Nothing seemed to really work with her, and different medications didn't really sort of work with her. So it was Dr. Kozlowska who was sort of thinking, well, we're working with FND, you really have to sometimes go outside of the box. And she had was familiar with Dr. Porges' work and heard about the Safe and Sound protocol and had approached us and to look to offer that. So we did a training with her team, and they started implementing the Safe and Sound protocol, but with this particular client in mind. So her team ended up writing up the case study that was published in a Harvard Review Journal. And I will put that link to that particular paper on the podcast Facebook page. And I know I've shared it with you recently.
Yeah, it's a fantastic paper.
Yeah, and it's a really nice paper that explains kind of how the team tried to engage in all the different approaches that they worked. And they started with the Safe and Sound protocol, going through 30 minutes sessions with this young lady, and she went from being wheelchair bound to walking with a walker to walking independently to actually engaging with all of her team of practitioners. And I think she was having tics and seizures, and all those things started to resolve. Her energy levels, her everything just shifted and changed. So it really did. And I think, as you said, it's kind of the difference is this sort of bottom-up approach to helping to resource the nervous system through that, through that vagal nerve, supporting that vagus nerve, but also the ear in terms of sort of processing acoustic information so we can actually engage and co-regulate better. So I think it provides another tool for people to explore as to help with resourcing the nervous system, definitely. So I'm so happy that you've been able to experience some shifts and changes yourself and to sort of share that with and I know that your work also is a lot to do with helping to provide education about FND and supporting practitioners, and I think that's really important work. That's why I wanted us to have this discussion, so we can help bring more awareness to FND, and because I'm sure there's going to be people who are listening who maybe are struggling with some of the symptoms that we talked about, and maybe aren't getting the answers, and maybe they can therefore look for more research or resources as some of the things that we've talked about. So is there anything else you think you'd like to, any advice or any other last thoughts you'd like to share?
There's a couple of things. One, and this is for people who have FND and for clinicians, it's really only been in the last 10, 15 years that we're developing therapies for this. And so research and the development of therapies is still in its infancy. And so we're, yes, there's trial and error, but the research that's coming out is so exciting, and the volume of research, I can't keep on top of it because I'm subscribing to all these different journals, and it's really exciting just to see what's coming through. So there is hope, and that the more clinicians know about these conditions, where the greater the outcomes. So for the clinicians listening to this, please go out and educate yourself. There are some fantastic websites that we like neurosymptoms.org. If you want to learn more about treating the condition or just understanding it. I'm on the social media committee for the FND Society, and we're releasing previously members only webinars on FND education. So there's a lot of fantastic resources on that website. That's www.fndsociety.org. Highly recommend signing up for that. For people experiencing FND, please check out sites like FND Hope and FND Support Services Australia, and especially neurosymptoms.org. It's so important to educate yourself, and in order to get on top of the symptoms and get the right treatment early.
Excellent. And we'll put links to those resources on the Safe and Sound Protocol podcast Facebook page, as well as on the show notes as well. So that those will be there. And we could even put a link to your Facebook page as well, Michael, for practitioners. I think that's a great resource for practitioners looking to connect with other practitioners who are working with clients that present with FND symptoms. And those early days of getting the information to get diagnosed. So we'll link all that up. And I think that's what it is. It's a matter of sharing knowledge and connecting together.
Yeah.
So they can do that. So this was excellent. Thank you so much. I knew it was going to be, because you're amazing to share information with, and you're sharing your personal story. So it's really, really appreciate your time and the work that you're doing.
Thank you, and I've really appreciated this experience working with you, and what another resource you've given me.
If you'd like to learn more about the Safe and Sound Protocol in Australia and New Zealand, please contact Integrated Listening Australia. The website is integratedlistening.com.au. And for the rest of the world, please contact Unite Integrated Listening at integratedlistening.com.